Alright, so a quick explanation of what has been going on. Yesterday, I tried to connect to the internet here at the home I'm at, staying in Florida on vacation, and it didn't work because nobody knew the Wi-Fi. So, right now, I am recording it on my friend's laptop because I've tried recording this goddamn speech 5 times using my YouTube account on my laptop, which is right next to this laptop that I'm recording it on, and it kept disconnecting the YouTube video for whatever reason. I'm not sure why. So now I'm going to recite the speech, recording it on this laptop, but reading it from my laptop, which is what I have the speech on. But I also sent the hard copy of the speech to you last night via email because I had it on my phone because I had 3G and it let me use it that way. I'm recording a video right now.
Okay.
Oh, sorry. Alright. No, it's my project, I mean, like, not just for fun.
Oh, I figured.
Sorry, I'm not starting over again though. Excuse me for that. But I'm going to try to do this honestly as quickly as possible because I'm very sick. I worked very, very hard making this speech, doing a rough draft, doing a second draft, and I'm also just not feeling very good right now. I'm sick, I'm drenched in sweat, so please excuse me for that. But please also take into consideration the given circumstances of my technical issues and physical issues. I'm happy to share with you today something that will hopefully shed light and possibly bring new meaning to your current understanding of anxiety, as well as the disorders, myths, and misconceptions surrounding it, and possibly broaden your current understanding of what it feels like to live with anxiety through knowledge and disorders, and acceptance that although you may never experience frequent anxiety, you can still be an ally to family, friends, or loved ones. To an individual experiencing anxiety, it's so overwhelming living with the constant anxiety. I appear to some as over-dramatizing or exaggerating. To those people, I need only ask one thing. What is your greatest fear? If you find your mind gravitating towards answers such as a bee or snake, you may be experiencing a common type of anxiety disorder known as phobic disorder, which is a specifically focused fear or disorder or situation of an object. If at any point you ask yourself, is she trying to diagnose me with a disorder? No. My objective is to show through personal ties and experiences how common an anxiety disorder can be, and that not every disorder is as severe as people tend to think. To understand things have to be bad before they can get worse, and just how quickly they can get there. Not everything can be painted in black and white terms. Anxiety is one of those things. There are many external sources of stress that, when overly considerated, can turn into anxiety, such as stress at work or school. Stress can also come from a personal relationship. Stress can come from finances or being diagnosed with a serious prolonging illness. Stress can also come as a side effect from a prescribed medication or from abusing a drug. Some anxiety, however, can stem from a childhood experience that left us stewing over it in our brains for an extended period of time. Others believe that for some, anxiety is innate or present in their temperament at birth, but can be made worse over time. Anxiety can, for many, make living in the moment an impossible task by being constantly preoccupied with what could go wrong in the future. Anxiety, nervousness, fear, tension, and worry, these words are all synonyms of one another. Anxiety itself is described as being a feeling of worry, nervousness, or unease, typically about an imminent event or something with an uncertain outcome. Taking a quiz or an exam usually generates feelings of anxiety prior to taking it. Feelings of anxiety are a natural human response to a new situation with an unknown ending. For anxiety to be classified as a disorder, it has to impair your normal functioning abilities, typically from excessive apprehension and worrying. A few of these disorders include GAD, general anxiety disorder, which is described as free-floating anxiety, long-lasting but cannot be attributed to any one single identifiable source. People with this disorder tend to worry in general, and more often than not, the worrying is unrealistic, meaning there's little to no cause for the level of irrational thinking. People with GAD and other anxiety disorders are living in a world of perpetual darkness, where the worst outcome from any given situation is usually the only outcome. Also, in terms of gender differences, women are twice as likely to experience general anxiety disorder than men. Panic disorders, another common type of anxiety disorder, leaves those affiliated suffering from attacks of extreme intense fear or dread. Panic attacks are most often brief but can be incredibly alarming and can strike without warning. The experience of a panic attack is often described as the person believing they are having a heart attack or the feeling that they are going crazy. The fear and terror associated with a panic attack are often unwarranted given the situation and can often be completely non-related to what is going on around them. They can even occur in one's sleep. The most sudden and unanticipated panic attack I ever experienced, I was driving through a busy highway with 3 other passengers. Try to imagine driving and you suddenly have a rush of fear coupled with an increased heart rate and a tightening chest with difficulty breathing, knowing that you have 3 other lives to take into consideration, not only your own. A very successful technique I myself have found during these difficult times is focusing on breathing, often associated with many techniques of meditation in an attempt to slow down your heart rate, which becomes increased during a panic attack. For some, however, this technique has an adverse effect, only worsening the situation, and for those people, the polar opposite technique is known to be very helpful, which is known today as a term called grounding, wherein you occupy your mind to regain focus and is particularly helpful in managing overwhelming feelings or intense anxiety. An example of grounding is to look around the room and focus on a particular object and begin describing it. During the exercise, you're able to ground yourself to the present moment by focusing on something specific to distract yourself from the panic attack. Excuse me. Recently, a close personal friend of mine named Malia opened up to me about her experience with panic disorders and the strategies she finds most helpful during these sudden attacks of panic. Malia quotes, "Lately I've been using acceptance and commitment therapy techniques which tell you to embrace the anxiety rather than push it away. Also, techniques such as confronting her irrational beliefs and reframing them. As scary as these attacks of fear and panic may seem, they do not need to stop someone from achieving what they need to achieve or want to achieve in life. For Malia, it hasn't stopped her from reaching academic excellence by means of receiving her bachelor's with minors in publications for child development. It also didn't stop her from furthering her education by entering into a master's program and completing it in 1 year rather than the norm 2 years. Malia also maintains a current 4.0 grade point average. She was able to get this far in life despite her panic disorder diagnosis by learning about her disorder and learning treatments and finding the right medications that work best for her. Social anxiety disorder takes place when people become increasingly and often self-conscious in everyday social situations. These people are often crippled with the fear of being watched and criticized by others. The physical symptoms of prolonged anxiety can be devastating and can include a weakened immune system, excretory and digestive system suffering, loss of appetite and lack of interest in sex. It can also take a toll on muscle tension, headaches, or insomnia. Being in a constant state of stress can even lead to clinical depression. Long-term stress of anxiety can lead to a higher risk of diabetes, high blood pressure, and heart disease. I consider myself to be a very fortunate individual. While being diagnosed with an anxiety disorder, I was also born into a family where I have experienced tremendous privileges. These privileges have included affordable and weekly therapy sessions where I have been able to learn about my disorder, in particular from a licensed professional, and learn techniques and strategies to put me back in the driver's seat of my own life. With the aid of therapy, I am able to remind myself during these times of interruption from my anxiety that I am the one in control of my life and I am the one who dictates where I go. I am also fortunate enough to have the privileges of affordable medications which have been proven to successfully, along with therapy, best treat some forms of anxiety disorders, allowing the symptoms of the afflicted individual to be alleviated to the point where the person is able to lead a fulfilling life once again. But what happens to those born into poverty? What happens to those individuals who are unable to afford all of the things that I have been so fortunate enough to receive? Around 18% of Americans have an anxiety disorder at one point in their life. That's roughly 40 million Americans. What happens to those who are suffering and are in a vicious cycle and are unable to receive the help needed to treat their disorder? My intent is not to focus only on those with anxiety, but to highlight those without it and what they perceive anxiety to be. My goal is for people without anxiety to be able to hear these words without feeling persecuted or blamed. Many people with anxiety merely want those who do not have anxiety to understand what they are going through. Understanding the difference between myths and the realities behind them can determine future support in helping a loved one or friend understand and cope with their anxiety. Some of the most frequently discussed and questioned myths are as followed. Snap your hand with a rubber band every time you experience unwanted feelings or thoughts. Concealing your feelings only worsens them. 2. If a panic attack gets too bad, the person could pass out. Fainting is caused by a decrease in blood pressure. During a panic attack, your blood pressure slightly rises, making passing out highly unlikely. 3. Avoiding stressful situations is important and helpful for those suffering with long-term anxiety. Avoidance of what you fear only makes it more intense as you encounter the source. Only when we come to terms with our fears do we have the potential to master them. People with anxiety are weak. Anxiety and the associated disorders can stem from a certain fear, absolutely. However, a condition does not have to define a certain individual. It is not the only component in their life. 5. Having a drink can soothe an anxious person. As a short-term solution, you may very well find that a drink or two helps calm down one suffering from intense feelings of stress or anxiety. In the long run, drinking can be a dangerous gateway into substance abuse for anybody when used as a coping strategy for unwanted feelings or emotions, but especially so for those with anxiety disorder. Alcohol consumption can worsen symptoms associated with anxiety. People with anxiety disorders are also 2 to 3 times more likely to experience a substance abuse problem than the general public. There's nothing I can say or do to help an anxious person calm down. Be inquisitive. Ask the person what you can do for them at that moment to be helpful instead of assuming that they might or might not need from you. An empathetic phrase paired with a calming tone of voice can sometimes alleviate some of the tension. Much like a normal individual dealing with a particularly stressful situation, sometimes all an individual might need is a friend with an empathetic vibe and open ears. Suffering or not, anxiety and the related disorders are very complex and incorporate many components. Looking at anxiety with a black and white point of view may only increase feelings of confusion and misunderstandings. People as individuals are naturally confusing, especially when examining disorders of the mind, but by keeping assumptions out of the mix and focusing on the individuals may help a broader understanding of anxiety, which can then in turn help in aiding those dealing with anxiety, be it someone dealing with an isolated episode of anxiety or suffering from a prolonged disorder. Knowledge is power, and the more we know and understand, the more we can begin to help.